God, I guess it's been over almost 2 years now. I take Adderall for ADD. So I
Mm-hmm.
tried taking promotion tests in the past and never came close to passing. So I asked my doctor about it. He asked me some questions. I had to repeat kindergarten. It's just one of those things that I didn't have the attention. Well, I started taking this medication. It's great. It, as far as my concentration is and I was able to pass the promotion test. I'm on the list. But it causes high blood pressure, which is another thing that I would like to talk about that day that I fasted. So I went in, which is another thing on my list I want to get rid of. I went in for my testosterone shot. They check my blood pressure every time. It's been 130 over 80 on average. But that day I was fasting, it was 94 over something, 70 something.
Oh, I love it when
pressure, even though I was taking the Adderall, which I didn't feel, because I usually take one when I wake up, which I did that day, and I take another one around 1 p.m. because I can't take it too late because it'll affect my sleep. So that 1 p.m. came and went, and I never took it. It was in my pocket the whole time.
Yay.
And I never thought of taking it because I felt good. Usually about around that 12:30, 1 o'clock, I start feeling the effects of not having it. So, so that was an improvement, which I would like not to have to take any kind of medication.
Right.
But as far as testosterone, and then because of the testosterone shots, my estrogen spikes. So I have to take an estrogen blocker.
Welcome to my office.
And 48 hours, so I have to take.
So let's just say all that out loud. Just make sure we did this right. So you had high blood pressure, and then you took a medication that helped your mental performance, but it increased the blood pressure, and it's something you have to take a couple times a day. And even though you got performance on that test really well, then for whatever reason, the testosterone was found to be low. So you took a medication that improves that, but it does it in such a way that causes these other side effects. So now we have to suppress this part of the hormone cycle and make sure we boost that part of the hormone cycle. Right. And welcome to the complexity of the human body.
Yes. And then one more medication they gave me.
Keep going. I want all of them to be gone. That'd be great.
Right. Well, the other one's not that big of a deal. They prescribed me, it's got to be special formulated. It's kind of expensive, but they prescribed me HCG for testicular atrophy because of the testosterone that I'm taking. I guess it causes those guys not to work anymore. So
absolutely. I think of it as the assembly line of all these fat-based hormones, and I'm talking about progesterone and estrogen and cortisol and estradiol. There's a whole gamut of them. They all started out with fat-based nourishment. And, I look at that improvement when people say, I'd like to get off these medications. We'll first take the low-hanging fruit and say, here's what's going to happen with the blood pressure. We'll talk about the ADHD one in just a minute, because it's one of my near and dear to my heart, my favorite things to talk about. But when it comes to these hormones, we're as a salesman would say, we're filling the pipeline. The pipeline goes in, and in about 2 to 3 months, we're going to be able to predict this is a sustainable, stable production of these fat-based hormones, and the removal of your testosterone is a little bit tricky, but your body will do such a better job of surging and valleying the testosterone hormone, unlike what happens when I give somebody a shot. When I give somebody a shot, I'm calculating it, I put it in their body, and it will float up and it will be high, and then it will trickle down. And if we do blood tests, we can say, oh, here's what level we hit, here's what level we hit. But that's not how testosterone works. Testosterone is a burst valley. It's supposed to pulsate. And the longer they take away the pulsation and we replace it with a man-made, injection, give this long testosterone, it'll fix the problem. It will improve that short term, yes, their body's working a little better, but the things like testicular atrophy, gynecomastia, which is the breast thing, and really that it's a cognition performance where they'll tell you that their brain just doesn't feel right. So put that aside and just have hopes that we're going to get to talk about that in the next 2 to 3 months. Probably after the first of the year is when we'll be able to tackle some of that. But for now, I want to know what is the amount of the blood pressure medicine that you take? What's the name and the amount of it?
I don't take blood pressure medication.
Oh, so the high blood pressure is something that you're preventing.
Right. I've always
worried about with the AD.
My whole life, I've had great blood pressure. The doctor says your blood pressure is perfect. My cholesterol has been good. My good cholesterol has been really high. But ever since I started taking Adderall is when I started noticing the blood pressure issues. And
right, absolutely.
Yeah, and my iWatch would tell me, like, so it doesn't anymore, but when I was on a carb diet and taking Adderall, I would have a resting heart rate of 125.
Oof, yeah, that's hard.
Yeah,
mm-hmm.
But
that's what Adderall does. Yep.
The higher heart rate since I've joined Jennifer in the keto diet, but the blood pressure's kind of been lingering around. So, and I know it's because of the medication. I probably if I stop taking the Adderall, I'm sure that'll correct itself.
Well, so when your blood pressure was that 96/60, how did you feel?
I felt good. That was the day I was fasting. I felt
good.
really, really good. I felt,
this is the most important part, is that the human body has a regulation process that it will perfuse the brain and keep you thinking and doing well, unless I'm giving you a medication to try and undo that.
Right.
And then I can try to outsmart your body. But as you shift the chemistry, like they go from a non-ketogenic diet, or even in your case where you were eating pretty keto, but the chemistry had really not been something anybody was checking. We're now trying to take this to the next level. We want to ignite the autophagy, do some of that repair of your knee, really see if we can get enough weight loss to get you off of that CPAP machine. All of those are really important. And if I'm giving you a chemistry set every morning in the name of, atenolol or, the blood pressure medicines, and then in many of my patients, it's a statin and it's another one. You say, no. If you're going to change the chemistry with the way you eat, now we need to change the chemistry with what the pills are too. They need to match your system.
Correct.
And so I have, many patients who have started on the ketogenic diet and they didn't tell me, or they tried to do it on their own, and they're still taking all the blood pressure medicines. And they're like, Doc, I thought I was going to die. I'm like, I thought you were going to die. You have to have help at transitioning one to the other. Right. But in a case like yours, where still pretty healthy, young male, having no blood pressure medicine, and even though they're monitoring your blood pressure medicine, nothing was suppressing it. So when you went on a ketogenic diet, you could put salt in and effectively treat any low blood pressure that was coming. But mostly you shouldn't have felt low blood pressure if you kind of kept ahead of that salt thing. So good job. I want to do one more thing with the Adderall while you're doing that. So when you were fasting, did you check what all of those ketone numbers that you had up there were in the morning? When you were feeling good and you kind of forgot to take your Adderall in the afternoon, did you happen to check what your sugar and ketones were then?
Actually, yeah, because I was working. Me and my partner were working traffic, and Jen called me and she said, "Hey, I'm out and about with the kids. We're really close. Let me come. Are you still fasting?" I was like, "Yeah, I'm still fasting." And she goes, "Let me come by and check your blood." So we were working this particular road with a lot of speeders. So she came by and I forgot what it was. Do you remember, hon?
Yeah, I do. And I vividly remember pulling off on the side of the road to get blood from your face while you're working traffic. So 22 hours in, he had 80, was his glucose, and 1.6 was his ketone.
1.6 and 80. Oh, so that's, again, one of the better numbers, right?
Yep.
That was the better of all my numbers. My lowest number other than that one was 82.
Because I would contend, so what was the ratio when you take those out? What number would you be at?
80 divided by 1.6, that's 50%.
Okay, perfect. So if you could hit a ratio of 50 or about there, I would contend that that's this kind of performance level chemically that doesn't require Adderall. And I would use that as a way to say, should I take my Adderall or shouldn't I? Because it is a difficult thing to come off of. People they learn to depend on that mental performance. But it is also a drug that has tachyphylaxis, which is a fancy word that says the longer you take it, the less effective it is. So we know that if you're taking it for that improved cognitive performance, especially if you have to take a test. I have child psychiatrists now who say, I will not write Adderall for these kids until the family has been properly introduced to a ketogenic diet. The mental performance is so much better than when you remove the sugar and watch what their brains can do. And the long-term use of this Adderall, as much as we can spot check and get their performance, especially for that hyperactive male, I have 3 boys in my house, so the male brain is very something I study way too much probably. But for real, they do need that. There are people out there that when they have the Adderall, it really does help them. But the longer they were on it, they got this attrition from the performance. And, they say, doc, I take it just like I'm supposed to. I'm not being manipulative of how to use the medication, but their performance from it is lesser. And then when you take it away, they get a depression, they get a slump, it's not fun. And so you'll get them saying, I can't be without it. I can't be without it. If you can push that ketogenic profile and then mentally make a note saying, if it's 50, I'm going to try and not take it. And that's where the autophagy and fasting and the cognitive calculations are really fun to watch how well people use that data to improve their life by taking the science lab into your life and saying, just calculate it. This is easy to figure out. And that's a pretty good number. I mean, I would have recommended.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.